So teen athletes are competing more than ever. Injuries are on the rise. Here's what parents need to know. Types of injuries we see in teenagers are ACL tears, shoulder dislocations, and growth plate related injuries. Why are teenagers at risk for these injuries? Well, there's many factors. One is they're growing. The body is growing rapidly. The skeleton wants to mature and the growth plate wants to calcify. While that process is happening, they're pivoting, they're cutting, they're jumping, and oftentimes there can be an imbalance between their muscle strength and the growth plate. This predisposes them to injuries at the growth plate. In addition, changes in hormones can make their tissues a little bit looser, particularly in females, making the ligaments looser and at risk for injury. To help prevent these injuries as a parent, there's a few things you can do. One is monitoring your child's activity level. Oftentimes we see athletes who are involved in multiple sports. They train constantly, they don't get enough sleep, and their body does not get enough time to recover. Every time you're involved in a sport where there's contact, impact, your body goes through these microtraumatic events, which cause inflammation. The growing child needs to recover, sleep, and get proper nutrition. If they're training 6-7 days a week and they're constantly in sports, oftentimes there is not enough time to recover. We put a lot of love into these videos. If you enjoy them, please hit like, comment, and subscribe. So I see a lot of ACL tears, and oftentimes the most important thing is making the proper diagnosis. Oftentimes there's a history of a pop or a non-contact injury. We examine the patient, and many times x-rays and MRIs are ordered in order to make the diagnosis. We recommend surgery for the teen athlete when they want to return to play at a high level. If they're low demand, tend to be sedentary, then we don't recommend surgery as often because they're not going to put the knee under the same amount of stress. If they wish to return to cutting, pivoting, high-level sports, then some type of repair or reconstruction is recommended. If there is a growth-related fracture, that could be a 2 to 3 month recovery depending on how bad it is. If it's just an overuse of the growth plate, most of the time it's rest and recovery, and it can be a few weeks. If it's a ACL reconstruction, you're talking more about 9 months to a year of recovery. So my advice to parents, especially when it comes to ACL tears in a growing athlete, is really figure out how much growth is left. I have a daughter who's tall for her age. She's 6'1" and tore her ACL when she was 12 years old. And I obtained multiple opinions, MRIs, and we did a bone age to make sure we knew how much growth was remaining and whether a reconstructive surgery was going to interfere with her growth. Thank God it did not cause any issues with her growth, and she recovered nicely. With your athlete, your child, really look at their health in general, look at their growth, their nutrition, their sleeping habits, and make sure they get their proper rest. So if your child has a sports-related injury and you're concerned about them, you can schedule a consultation with one of our doctors here at Modern Orthopedics. We're happy to help you with the diagnosis and treatment so that we can protect them and prevent future injuries.